Good morning. This is All India Radio, Kohima. The morning news read by Jonas Yantan. Minister of State for Development of North Eastern Region, Dr. Jitendra Singh, has said that the ministry is proactively assisting all the 8 northeastern states to fight the second wave of COVID-19 effectively. Chairing a review meeting with chief secretaries, health secretaries and central government officers on COVID preparedness, Dr. Singh informed that Japan and United Nations Development Programme (UNDP) have partnered to provide 8 oxygen generation plants to ensure uninterrupted oxygen supply at hospitals in the northeast. These plants will support more than 1,300 hospital beds across the region. Dr. Singh also assured the states that they will get their fair share from foreign aid pouring in India, and all attempts will be made and they will not be left behind in the fight against corona. The minister said a fund of 369 crore rupees dispersed last year for 14 health and COVID-related projects had helped significantly to ramp up health infrastructure, including purchase of new equipments. Dr. Singh said all the states are better prepared to fight the pandemic. The Angami Youth Organization (AYO) has appealed the high-powered committee on COVID-19 to devise additional modalities to be effected during or immediately after the lockdown period, particularly in providing effective vaccination to the public apart from contact tracing and testing in the face of recent surge. AYO said lockdown for the sake of lockdown will not necessarily serve its purpose if these core issues are not appropriately addressed. AYO said it trusts the authorities that vaccinations will be made available for the public in this second wave, as getting vaccinated is the only possible shield, in addition to following all SOPs. It said that state's fragile economy is likely to be adversely affected, especially the poor, and expressed confidence that the government is prepared to assist in mitigating the foreseeable impending dangers. The organization also appealed all the business houses, especially those selling essential commodities, not to hike their prices. AYO further said it is a collective battle in which all must contribute in all dimensions to fight the second wave. Movement of all private and public transport vehicles will remain suspended during the statewide total lockdown, except for medical emergencies with 50% occupancy and adherence to COVID-appropriate behavior. All other cases will require special permission from the district task force. However, government vehicles whose movement are required by the exempted departments will be allowed to ply subject to production of valid ID cards on demand. In addition, movement of interstate transit passengers will be allowed as per the revised SOP for returnees and travellers entering Nagaland. Further, all places of mass gathering will be closed, and all social, political, sports, entertainment, academic, cultural, religious functions and other large congregations barred except for solemnization or weddings with prior permission from district task force limited to a maximum of 20 persons. Funeral services will also be limited to not more than 20 persons. Nagaland reported 269 fresh positive cases of COVID-19 yesterday, taking the total tally to 16,552. State Health Minister S. Pangyupom tweeted that Dimapur reported 207 fresh cases, Kohima 40, Tuensang 8, Mugukchung and Mon with 4 each, Pek 3 and 1 each from Longleng, Zunaputo and Peren. Of the reported new cases, 107 cases were detected through self-test and random tests, 66 traced contacts, while armed forces, security personnel and returnees registered 47 cases each, and 2 were frontline workers. The minister also added that 45 positive patients have recovered from the infection, adding the tally of recovered cases to 12,779. Dimapur recorded 31 recovered cases, 10 in Kohima and 4 in Longleng. In addition, of the 6 deaths registered yesterday, 5 were of COVID deaths, while the other was non-COVID-related death. The state has a total of 145 COVID deaths, while 11 deaths were not related to COVID. Presently, the number of active cases in the state stands at 3,081. And as the number of COVID cases is on the rise, we appeal to our listeners to take all the precautions and all those above 18 years of age to get vaccinated without any hesitation. Stay safe and protected by following these three simple steps. Wear a face mask, focus on hand and face hygiene, and maintain a distance of 2 yards for social distancing. With that, we come to the end of the morning news. Have a nice day.